Hey guys, my name is Dr. Ross Bernstein. I'm a veterinarian. First off, thank you guys for tuning into my channel. In the next video, you're gonna see one of the most interesting cases I have ever seen. So stay tuned. So this is a case of a wild, adult African male lion that was living on a reserve in South Africa, and the tourists that were on safari noticed that it had been vomiting over and over and over again. It had also been losing weight, and while it was normally part of the pride, doing its normal lion things, it just really wasn't doing well, and the vomiting was probably its most notable clinical sign. And so that's when the people on the safari contacted us, and that's when we got involved. So you might be wondering, if this lion is wild, why are veterinarians getting involved? And you're totally right. Normally, if a lion is in the wild, for example, in the Kruger Park, veterinarians probably wouldn't get involved. But there are plenty of lions out there and other animals that are living on privately owned reserves. And so, in fact, they do have owners. And even though they're monitored at a distance and they live in the wild, their owners are still concerned about their well-being. So anyway, back to this lion's case. It was vomiting, losing a ton of weight, not doing well, lethargic, and so called the vets. When an adult male lion is vomiting, or I guess any lion in general in the wild is vomiting, there are several things that veterinarians start to think of that could be the cause of that vomiting. One of the number one causes of vomiting in a lion is going to be a GI obstruction, and lions actually tend to be quite indiscriminate eaters, kind of like dogs. And they can eat trash, they can eat rocks, dirt, bones, and just if this were your cat or dog, if something went down and got stuck somewhere, they might start vomiting. And so that's what happened in this lion. Of course, we didn't know that right when all this started, but that's why we do diagnostics to try to figure out if it could be something else. So we did blood work, we did x-rays, we did an ultrasound, and those were all these tests that we did that confirmed where the problem was and what we could do to try to fix it. The first step in getting a wild lion into the hospital is going to be darting it. So typically in the darts we use what's called telazol, which is a combination of drugs called thalidomide and zolazepam. And when you're darting them, you want to make sure you're a safe distance away from the lion. You're going to want to be aiming for one of the large muscle bellies, usually in the thigh region. If you're really experienced, you could aim for one of the arms, but that is much more dangerous because if you miss and you hit the chest, that could cause a pneumothorax, which you definitely don't want to happen. So generally tend to aim for one of the back legs. So cool, darted the lion, got to the hospital. Now it's time for your physical examination. And this is really your chance to look at every part of the body that you can. And you know, you got to take advantage of these times because they're a dangerous animal. When they're up and when they're awake, you can't get that close. So this is your chance to really look at the eyes, the ears, the mouth, its abdomen, its paws, everything. This is your chance to really look at every single part of the animal. Probably around at the same time you're doing your physical examination, there's another group of veterinarians or technicians that are with you that are going to want to start intubating the lion to make sure that it stays asleep while you're doing your examination and for the rest of the procedure. So as you can imagine, the ET or endotracheal tube that you're using for this lion is going to be huge because it's much bigger than your average patient, but you're going to want to lift up the mouth, pull out the tongue so that you can properly see the glottis and know where you're putting your endotracheal tube.
This thing is too short. I think it's in. I can feel it running down the tracheal rings. Alright, just tie him in. going to radiology. I'll bring the large animal.
Let me wait here first. That's
Wait.
wait. You've got to
Oh,
wait.
wait. That's fine. I don't.
Cool, so we got the endotracheal tube in, we got an IV catheter in, we're stable. The next step is diagnostics, and diagnostics are things such as blood work, x-rays, CT scan, ultrasound, different tests that you can do to try to confirm or rule out different differential diagnoses that you have. And so sometimes they're not always straightforward, but fortunately in this case they were, and they confirmed our suspicion of what we thought was a foreign body obstruction, and in this case in the stomach. We didn't really know exactly what we were going to find yet, but we had our suspicions. In this part of the surgery, you see us passing an endogastric or EG tube. That's also commonly referred to as stomach tube. And so when we're in surgery, the stomach can be very large. It can be filled with fluid, filled with gas, filled with ingesta or just food that it's eaten, in this case even some foreign material. But the stomach's very big, and a way to make it smaller and let the surgeons have better visualization and see everything they need to see, passing that stomach tube down into the stomach can help us empty the stomach, thereby increasing our visualization and lets us do what we need to do. Alright, so foreign body obstruction, the next step would be surgery. So we got to get the patient ready for surgery, which means shaving the hair on the abdomen, clipping all that fur away, scrubbing it down. We're going to be using solutions like chlorhexidine and alcohol. We're going to move it into the operating room, get it all draped and ready for surgery. Meanwhile, we have a whole team of anesthetists monitoring its depth of anesthesia, and for these things you can assess jaw tone, eye position, heart rate, blood pressure, all the same stuff that you would be checking for if this were a cat or a dog under anesthesia. In this case, the name of the surgery is an abdominal exploratory surgery, where we're basically going to be going into the abdomen and looking for any abnormality that we can find. In this case, we had already suspected it was a GI foreign body in the stomach, but we're still going to go in and assess all the organs, look at the stomach, look at the intestines, look at the kidneys, look at the liver, and just make sure that there's nothing else in there that may or may not be abnormal. Cool, we're in the abdomen, we started the surgery, and there's foreign material palpable in the stomach. We're not in the actual stomach yet, we can just feel it from the outside. So what we gotta do next is be able to exteriorize the stomach and be able to access it, and at the same time limiting the contamination of the contents inside the stomach with the rest of the abdomen. So we put what's called stay sutures in the stomach, in the wall of the stomach. Stay sutures are just basically sutures that you put in, put a little clamp, cut it, and you can lift up these sutures and exteriorize the stomach. The surgeon can make an incision along the body wall and access the contents of the stomach. Here we go. You can see us actually lifting the foreign body out of the stomach. This is my favorite part of the surgery always. So it's actually what's called a trichobezoar, or more commonly known as a hairball. And in this case, it was mixed with a ton of dirt and rocks and I don't know, some other unidentifiable objects, but we were able to get it out.
With this lion, should you be careful of fatty liver now? Because it hasn't eaten for a while.
Alright, so we finished the surgery now. We're done doing our abdominal explore. We've looked at all the other organs. We're confident that we think that relieving this gastrointestinal foreign body was ultimately the cause of this lion's vomiting, and so we're done, and now we got it transported back to a place where it can recover before it's being released back to the wild. It's still going to be groggy from all that anesthesia and painful from the surgery, so we got to let it rest and recover first before just letting it go back into the wild. Hope you guys enjoyed the video. Hope you guys have a new passion for wildlife and wildlife medicine. If you guys have any other questions or concerns, just leave me a comment below and I'll do my best to get back to you. Thanks again for watching.